Okay, good afternoon, everybody. Before I get into the numbers, I do want to send my best wishes and hope for Martin Haber's quick recovery. I think all of you here in the press corps and many of you watching know who Martin is. He's a regular member, and gosh, I don't know how long he's been here, of the State House Press Corps. He did test positive for COVID-19, and we're wishing him a speedy recovery, and just want Vicki to know that we're thinking about him and supporting him. Next, I want to offer my thanks and appreciation to all of our state, local public health officials. You know, throughout the pandemic, these individuals have worked long hours under immense pressure to develop guidelines and provide the information needed to keep their community safe from the threat of the virus. Unfortunately, these guidelines have too often been met with frustration and hostility from community members. Not coincidentally, since the pandemic began, 27 local public health officers across our state have left their positions. Our public health professionals are our neighbors and our community members, and they deserve our highest respect and gratitude for their very hard work. That's why from now on, beginning my press conferences each week, I will highlight the work of one of our state's local public health officials. This week, I want to recognize Jennifer McKinney, the health officer for Wilson County. Over the past several months, Jennifer's efforts to flatten the curve in her community have been met with opposition. She's been criticized on social media and received threatening emails. But through it all, Jennifer has continued to do everything in her power to keep Wilson County residents safe, including advocating for a local face covering protocol. She has never lost hope and has never given up on her community. Last week, the Wilson County Commissioners reversed course and implemented a face covering protocol. Again, I offer all Kansas public health professionals my thanks and ask all Kansans to join me in supporting these health heroes. Now for the COVID-19 numbers update. Since Monday, Kansas has reported 4,615 new cases and 119 new deaths. This brings us to a total of 162,061 cases, 5,290 hospitalizations, and 1,583 deaths. And we do not know yet the full impact of Thanksgiving. While I hope that Kansans took the necessary precautions to celebrate safely, state and federal health officials are preparing for a significant surge in cases over the next 10 to 14 days. Additionally, while case numbers may have dipped slightly, the strain on our hospitals and healthcare workers has not. Currently, there are 0 staffed ICU beds in our state's southwest region, and ICU space in our south central region is nearly at capacity. Our smaller, rural hospitals continue to struggle to locate staffed beds at our larger healthcare centers for transfer of critical patients. Healthcare workers and staff are stretched thin, particularly as more and more of them must quarantine due to exposure to a COVID-19 positive, or they've contracted the virus themselves. We all must remain vigilant. We must all continue wearing face coverings, physically distancing, avoiding large gatherings, and practicing proper hygiene. As you all know, ensuring Kansans have access to accurate information is one critical facet of my administration's all-of-the-above approach to keeping Kansans safe, our businesses open, and our schools in session. Thanks to the hard work of the Kansas Leadership Center so far, they have received commitments to hold more than 750 convenings to educate and engage communities and promote local activities to stop the spread of the virus, with more to come. The Leadership Center is also creating a database to track the meetings and resulting action projects and outcomes in real time. Additionally, Stop the Spread Kansas, our campaign to urge all Kansans to do their part to curb the spread of COVID-19, launched last week. TV, radio, digital, and social media components are available at www.stopthespreadkansas.org. Resources to help spread the word and not the virus in English and Spanish are being added to the site regularly. Additional TV and radio spots focusing on keeping Kansas open and access to health care are in production and will be launched soon. I would like to thank the Kansas Hospital Association, the Kansas Chamber of Commerce, the Kansas Farm Bureau, and our other partners for moving expeditiously to create, support, and amplify the Stop the Spread Kansas campaign. I'd like to end today's press conference with the first of what will be a weekly update on my administration's vaccine distribution plan. We will also be sharing vaccine information this Friday on our biweekly local stakeholder call with county, city, and business leaders, as well as legislators and educators. Before I get into the specifics, I want to stress that we are still in the very early stages of vaccine production and deployment. And as happened early on in the pandemic, I anticipate information and guidelines will be amended and evolve rapidly. Since the start of the pandemic, I vowed that I would be straightforward and honest with the people of Kansas and that my administration would follow the guidelines of our scientists and public health experts. I understand the significance of what a widespread vaccination program will do for our health, our economy, and our schools, and I remain committed to transparency throughout the process. Now, in terms of the COVID-19 vaccine, here is what we know right now. COVID-19 vaccines produced by Pfizer and Moderna could be authorized for emergency use by the Food and Drug Administration as soon as December 10th and December 14th, respectively. A third company, AstraZeneca, also has a vaccine in clinical trials, but no date for an emergency use authorization has been set. Kansas is estimated to receive 24,000 doses in our first shipment of the vaccine, which will come from Pfizer. This shipment could arrive in our state as soon as mid-December, while we are estimating the first shipment from Moderna will arrive shortly thereafter, and with shipments from both continuing to arrive on a weekly basis. In all, we're preparing for approximately 150,000 doses by the end of the month. My administration's vaccine distribution framework is in line with CDC's Advisory Committee on Immunization Practices recommendations. Importantly, the vaccine will be made available based on principles of maximizing benefit, minimizing harm, and striving for equity, justice, and fairness. The distribution order will begin with high-risk healthcare workers and nursing facility residents. Those will be phase 1 groups. Phase 2, and I must also say that there will be others who will be added to the phase 1 group as we're putting together this plan. Phase 2 will be those non-high risk who are 65 years of age or older. Phase 3 is the non-high risk under 65 years of age. We've created a timeline for vaccine distribution. Obviously, adherence to our timeline will be dependent on receipt of the materials from the companies. We'll work to ensure that as many phase 1 groups as possible are vaccinated by the end of the month. Phase 2 and 3 will be administered the vaccine on a rolling basis between the winter and late spring. At the state level, the Kansas Department of Health and Environment is working with healthcare providers across the state to be ready to vaccinate Kansans when we receive the vaccine. More than 200 providers are in the process of signing up to distribute vaccines or have already signed up. This number is growing quickly, and we expect it to continue to do so. These providers must meet certain licensing requirements, agree to the conditions set forth for administering the vaccine by the CDC, and must be able to provide certain key minimum data requirements. Vaccines will be delivered to pre-positioned locations equipped for ultra-cold storage throughout Kansas. The ultra-cold storage temperatures are required to store only the Pfizer vaccine. We'll be setting up other storage possibilities for Moderna. Due to security reasons, we will not disclose the locations of these facilities. From these locations, vaccines will be distributed broadly to provide vaccine coverage to healthcare workers initially. We have laid our framework to prioritize vaccine delivery to those on the front lines of our pandemic response or those disproportionately affected by the virus. With this schedule, we intend to protect the greatest number of Kansans, foster economic recovery, and get our kids back into our school buildings as quickly and safely as possible. The vaccines themselves will be free. However, vaccination providers are allowed to charge an administrative fee for giving the shot. But no one will be turned away if they cannot afford the administrative fee. I understand some Kansans may have hesitations about getting vaccinated. To date, the vaccines in trial have been tested on tens of thousands of people and have passed safety requirements in both phase 1 and phase 2 trials. As an additional layer of checks and balances, an external advisory board made up of medical and research professionals using additional public health data will review final COVID-19 vaccine data. Lastly, I would like to remind everyone listening that we did not begin manufacturing coronavirus vaccines at the outset of this pandemic. America's best medical and research professionals have been working for years on coronaviruses for things like SARS, which is also a coronavirus. If you remember at the beginning of this was called a novel coronavirus because it was different than SARS, but it's in the same family. The lessons learned through the developments with SARS are being applied today, which probably what allowed these companies to move at warp speed to develop these vaccines. Before I take questions, I want to reiterate that this news of an upcoming vaccine does not mean we should take our foot off the gas. We must continue to encourage widespread testing, wear face coverings, and employ other mitigation strategies. Listen to advice from our public health experts on the local, state, and national levels. We have seen what can happen when these common sense mitigation efforts are not appropriately followed. For example, due to increasing case numbers and hospitalizations in Sedgwick County, this week, Wichita Public Schools, our largest district, announced that all elementary school students will be returning to remote learning. If we as a state commit to following public health guidelines, we can keep this from happening statewide. And we can ensure our Wichita Public School kids that they can return to in-person classes. And with that, I'll take questions, and I've got Dr. Norman here, our Secretary of Kansas Department of Health and Environment, to answer any of your questions that I can't.
A technical question, these dose numbers, the 24,000, and then you hope 150,000 by the end of the month, are those the number of doses, so those would be for half the number of people?
Mm-hmm. Yes. You know, people are required, it's most effective if they get 2 doses. They get the initial dose and then 3 to 4 weeks later, the second dose. So when you're looking at 150,000, you're really talking about 75,000 people who can be vaccinated fully by the end of December.
Governor, will the public schools require students to get a vaccine, and what will the procedures be for that?
You know, right now, the vaccines that are coming out are not approved for children. So they're just approved for adults 18 and up. So, you know, we need to wait to see if we get a vaccine that kids can take, and then we'll make those decisions.
I think yesterday, Governor, I'm sorry, but yesterday Phil Griffin was saying that it's 23,750 doses that they're expected to receive. So it's 24,000.
I rounded it up.
Oh, okay. What would you guys do with the limited amount that you're having? Are you expecting more to come immediately after, like a second shipment?
Well, we expect the first shipment from Pfizer to be about the 24,000. You know, then we're expecting, you know, a week or so later, a shipment from Moderna. I think that's closer to 50,000. I think it's 49,000 in that one. And then we expect weekly shipments from both companies to continue going forward. So the initial vaccines that we get, the initial group that we will be targeting will be those high-risk healthcare workers. 25,000 or 24,000 is not enough to even take care of all of our healthcare workers. So we'll target the high-risk ones, and those will be the people working on the COVID units in our healthcare facilities.
Dr. Norman, can I ask you, there was some mention of vaccine hesitancy. What efforts is the state and your agency planning to kind of combat that hesitancy and address those concerns? And how prevalent is vaccine hesitancy even among the medical community? Because I've spoken to like an EMS director and people who represent nurses to say even within the medical profession there are some concerns and some questions.
Yeah, good question. Vaccine hesitancy, whether it's the general public or even within the medical profession. A couple of things. One, and the governor pointed this out, about warp speed. The warp speed is the production of the vaccine. The warp speed isn't that the phase 1, phase 2, phase 3 trials have not been given sufficient length of time to do that. And that's really important. The governor mentioned AstraZeneca, European-based at Oxford University. Oxford's been working on this for 18 years. Since the SARS came out. So the warp speed part of it is a production and delivery to the citizens. It is estimated right now, Pfizer, I should say, has estimated that about 30% of people will not be quick to receive the vaccine, but rather going to wait and see how does it go with the first rounds of people doing it. So we expect that some people are vaccine hesitant about every vaccine on the planet, and we probably won't do much to sway them unless they see continued problems with the COVID-19 around them, which they obviously will for a while. But about 30% would be the number we'd expect.
Do you have plans for like a formalized campaign of any sorts or formalized effort?
Yes, we have a lot going on with that. We've, in terms of communication, transparency, and then, the safety data particularly is what has people uneasy, I think. And I think that one of the things you will expect to see is us repackaging and retelling it in something that's very digestible to people that are not necessarily scientists.
Yeah, and if I could add to that, I mean, that's part of our all of the above approach, that we're really taking an aggressive communications process and spreading it all around. Obviously right now we're focusing on the testing because we've got that coming out. We will, re-message when we're talking about vaccines. So we have every intention of investing heavily on marketing and education for folks.
Governor, does the state have the necessary funding for short-term and long-term staffing and administering of the vaccine?
That's a really good question, and the answer to that is yes, we have short-term funding. We can get through December, but I think everybody is fully aware that ends the CARES Act program on December 30th. It is imperative that folks back in Washington and Congress get it together and pass another stimulus package and ensure that states can staff up and get folks vaccinated as need be, among the variety of other things they need to ensure states have.
Governor, so the way this is going to work, the vaccine is going to go, the Pfizer vaccine is going to go to certain undisclosed locations, a small number, 5, 6, 10?
Yeah, that's a much smaller, obviously. Those are super specialized storage units that are very, very cold. So we don't have a ton of those, but we've got enough, and we'll be able to get the Pfizer vaccine in there, and we'll be able to distribute it from there.
How long will it be, though, for it to get to, say, a rural area way out west, for example?
Well, we have a variety of ways of distributing that don't take that long. We do have, we have our emergency management folks. We've got helicopters, we've got couriers, and we will use what we need. That's what's being put in place right now, is a very organized, systematic approach to distribution.
One more question?
I have a question from Wichita. They were saying that Kansas reported 119 new deaths, as you mentioned, and they were asking the KDHE if that was due to reconciliation, and they said no, but their local health department there said the numbers were from April through November. Do you all have any clue on that?
The 119 number?
Yeah, if those were new deaths or like old ones that are just being reported now from April through November is what their health departments.
I'll let Dr. Norman take that one.
Thank you, Governor. Yeah, it's a good question. It comes from a variety of sources that when there's an uptick in the number of deaths like that, and it's not been because those have happened in the last 2 days since the last reporting was done, that comes from death records, the death certificates, and they might not have been signed out at a hospital, for example, as a death, but when it comes in. So people also, because they've been so swamped, quite honestly, at local health departments, in terms of entering data into our epidemiology tracking system, that it's not done necessarily in a linear fashion. So they batch in terms of the numbers coming in on a particular day.
And I think, last week was a holiday week.
Yeah.
Right.
Secretary, can you talk about prednisone? Do you guys have plenty of that on hand? And just a personal reason, both my parents tested positive. They do not live in this state, and the doctor put them on prednisone. I was just curious, if there's plenty of it out there, and
Yes.
What all does it do to quicken the patient?
Yeah, prednisone is a steroid medication that's used to decrease the inflammation, typically in this situation, probably in the lungs. And it's been around forever. It's all sorts of generics, and there is no shortage on prednisone.